First question, you got the vaccine yesterday. Probably very exciting given the year we've had. Can you kind of explain that experience and also how you're feeling today?
Well, first I'd say I want everyone to get the vaccine. It's safe, it's effective, and it's free. I received the vaccine yesterday. We opened it up for individuals 55 years old and older. We made the announcement on March 1st. I got the vaccine yesterday. It was basically pain-free. I had no side effects. I think my shoulder was a little bit sore. If you ever get a flu vaccine or another vaccination, it felt like that. But I didn't have any after effect at all. They're really humming out at State Farm Stadium, home of the Arizona Cardinals and J.J. Watt. It's a 24-hour mass vaccination location. We also have one at Phoenix Muni, and we have one at Gilbert Chandler Community College. I want to thank Michael Bidwell and the Cardinals for being the model for what other states are doing around the nation. President Biden came here and virtually toured it. So did Vice President Harris. Bobby Robbins down in Tucson opened one at the University of Arizona. So we want people to go on azhealth.gov, get an appointment for a vaccination, and hopefully in the next several weeks we can meet again and I can tell you about the next age category that we're going to expand vaccinations to.
And I know before the state was looking more at the phases, as was Maricopa County, and I actually happened to do a story on this last night, but you had some essential workers upset that it was changed to the hybrid method where you went to 55 and older and they weren't originally going to be in the phase 1B. So can you kind of explain the state's decision to shift gears a little bit on the vaccine distribution and what went into making that decision?
Sure. Our objective is to get this vaccine to everyone who wants it, and we want everyone to be protected. But we know that you're more vulnerable the older you are or if you have an underlying health condition. So we wanted to simplify the system. We only have about 55% of Arizonans that even want the vaccine right now. So the more far and wide that we can get it out into the maximum amount of arms, the better we can build confidence so that we can have everyone in every part of our state and in each of our communities have access to it. We also have to get over a little bit of vaccine hesitancy that's been there, or historical apprehension for things that have happened in decades past. So those are all things that we're working on. The most important thing right now, especially with our numbers trending in the right direction, meaning positivity is becoming lower, hospital capacity is expanding. The virus is not spreading at the same rate that it was spreading at several points in the past year, as we want to make sure that vaccine doesn't sit in the freezer or the refrigerator, that we get it in people's arms.
That 55% number could be better in terms of Arizonans that want to get the vaccine or are planning on getting the vaccine. What's the state doing to try to instill more trust in Arizonans? Because I know to get to that herd immunity, we've got to get that up closer to 75. So what are you guys doing to try to make that better in terms of getting more people to feel safe getting the vaccine?
That 55% number is pretty consistent across the country. So first things first is we want to get that coalition of the willing in line, because we think a lot of folks are in a wait and see mode. We want to see if there's any after effect. We want to see if it works. We want to see if the spread slows. So all the evidence is in on that to date. Other people want to hear from subject matter experts, typically a leading doctor or healthcare professional. So we're working with those individuals both at the state level and nationally. And then other people want to hear from folks in their community. We've worked with faith-based leaders from around the state that are inside our different communities. We had a setting where they were vaccinated in front of their congregations. Their congregation was able to see that they didn't have any after effect. It wasn't painful. And to date, they haven't contracted the disease. So we need to build confidence with people that are skeptical. That's part of what we knew would be in front of us. And the first thing we can do is get it out to everyone that wants it. And then those that are sitting on the sidelines observing to say, okay, now it's my turn.
I know the county is going to kind of focus more on the phases and the essential workers while you guys go more the age route. But overall, Arizona has a supply problem at the moment. What's coming next in terms of getting more vaccines here? I know the Johnson & Johnson vaccine is huge. and should help, but the county told me they think they're behind probably a month to 2 months in terms of demand outweighing the supply. How do we help that situation, and is there more that the state could do to help it?
The Johnson & Johnson vaccine is a real help to us. The more vaccine we have, the better off we're going to be. We're on the federal government every day asking for more vaccine, and we think Arizona deserves more vaccine because they sent this out by population of where people live. But if you remember, the vaccine wasn't available until December. And we have a lot of snowbirds who are welcome in the state of Arizona, but they come here in that October, November time frame. So now they're going in our lines, they're receiving our vaccine while their vaccine is in Idaho or Illinois or wherever they came from. We think the federal government's beginning to understand that, along with the supply chain finally catching up, the Defense Protection Act being put into force, and we're being told by people who know about this that we should have more supply than demand in the next 4 to 5 weeks, and that would be a great problem to have. We've asked for as much vaccine as they can get. We know that they want to get it out fairly and equitably across the country, but we also think because we've demonstrated our skill in getting it out quickly, that you don't want to send it to places where it's sitting. We're being effective with it. That's a testament to Dr. Kara Christ, our county health officers, and we're going to continue to do that.
In terms of the pandemic shifting, I know you've been very pro keeping businesses open, keeping the economy flowing in Arizona. Yesterday, Governor Abbott in Texas said no more mask mandate, but also said businesses can open to 100% capacity. We are not there in Arizona yet, but he's another GOP governor, you are a GOP governor. Is this something you're looking at doing too in terms of fully opening businesses in Arizona?
Our economy is open and it's going to remain open, but any decision that I make is going to be in the best interest of Arizona. We found a way to keep our economy opening and thriving. We're the #1 state in the nation for state tax revenues among states with major metropolitan areas, but we also want to make sure we're protecting our people. So this idea of wearing a mask, of having personal responsibility, of being smart and vigilant, we're almost at the end of this marathon. We want to do what's right for Arizona, and I'm sure that Governor Abbott's doing what he thinks is right for Texas.
Do you think there's going to be any change in terms of business capacity in the next coming weeks?
We think that there's blue sky on the horizon. Every indicator we see says that we should soon have this behind us, but we've been in this position before, so we want to make sure that we're cautious in making the right decisions for the state of Arizona. You know, it's hard to have a big reopening when you didn't have a shutdown. We've been able to keep our economy open and do it safely.
Let's talk schools, because you know this is a huge topic, and obviously with your executive order today this changes some things for some of the school districts in Arizona. So now that you are saying that by March 15th there needs to be an in-person option for all schools unless they're in those areas where there's that high transmission, that does change the game for some school districts who voted to go all virtual for the rest of the year, or have found in their community that that is a better option for them. Why did you want to make it an executive order versus giving the decision to school districts to say you have to have an in-person option?
We wanted to bring clarity to this situation. Many of our public schools are already open and operating, but with the CDC saying that the safest place for kids to be is inside a classroom, we wanted the folks around the state, the school leaders, to know that we will be opening our schools and have that in-classroom option by March 15th, and we just didn't want there to be any confusion about it. Distance learning has not been good for so many of our kids. Many of our kids don't have Wi-Fi or a computer or multiple screens, even though there are multiple children in those families. We need these kids back inside classrooms. We need to get these kids caught up. We need to have resources flow to whether that's summer school or acceleration academies or after school one-on-one tutoring and instruction. We don't want our kids to lose any more learning than they've already experienced since this pandemic. We've listened to the experts around public health. This is the safe place for kids to be. We prioritized in Arizona our teachers getting the vaccine right from the get-go. Let's get kids back in school and get them caught up.
And I know throughout the whole pandemic, you've been very adamant about wanting kids to be in classrooms if they could be because of the learning detriment from home. What do you say to the teachers in the school districts who have been all virtual, who are continuing to be, and now only have a week and a half to completely change their schedules and curriculum? A lot of them are stressed out because there just wasn't a lot of time before, it's March 3rd to March 15th. So for those districts who are like, oh my gosh, how are we going to make this happen? What's your response to that?
Well, first, we've been preparing to go back into the classroom the entire time. We never thought that we would be virtual and remain virtual going forward. We know there are some children and families in unique situations, and in those situations, they're going to continue to be able to learn virtually or online, but there are many parents that are working parents or two working families. They need a place where their child can go and learn and have supervision. This brings clarity to that challenge, and it's going to happen March 15th.
Was any of this decision to have this in-person option and get more kids in person related to the fact that they will be taking standardized testing and you want to have the best scores possible for Arizona kids?
This has all been done in consultation with public health experts, with education champions and superintendents and public instruction leaders from around the state. And the idea is that many kids have fallen behind. There has been learning loss. We want to make sure that our kids get a day worth of learning for a day of school that they've taken. And now that we know that it's safe, and we have that across the board from every public health leader, we need to get these kids back in classrooms.
It's been almost a year since everything shut down, which is hard to believe, but also it feels like it went by really fast and then extremely slow. As governor of Arizona, we have seen changes all over the board when it came to the pandemic, certainly just with doctors learning more as we went with the virus, learning how to adapt to situations. What do you feel you've taken away the most or learned most about through having to adapt and lead an entire state through a global health crisis?
What I've done is listen to public health, make the best possible decisions given the changing environment, staying out of the politics and off of social media, and listening to subject matter experts, and prioritized lives first. That's what's most important in this pandemic. But then also being targeted and measured and balanced so that we didn't have some of these sweeping edicts or orders that you saw elsewhere. By listening to public health and making these balanced decisions, I think we've been able to do as good a job as possible in slowing the spread of the virus, making sure we've had hospital capacity the entire time, and then allowing our economy to move forward as well. I mean, there's so many things that happen with a pandemic. First and foremost is COVID-19, but there's other things that people haven't been measuring, like addiction and alcoholism and domestic abuse and isolation and suicide attempts. These are all very real issues and metrics that people have not been talking about. We've looked at public health holistically and tried to make the most responsible decisions possible given the information that we had.
What do you say to your critics?
Well, I have a job in terms of making decisions, and I am surrounded by incredibly smart and caring people to the folks in Arizona, and critics are going to do what they are going to do. My job is to listen to the facts and then make the decisions, and that's what I've done, and we've worked every day and been thoughtful and stayed out of the politics of this. And I think in this type of environment, in what was an election year and something that has been so politicized, criticism is going to come from where it comes from, but you want to be at peace that you've given it your best and you've done the right thing, and that's what I've done.
Very last question. how do we feel about a J.J. Watt cameo at State Farm Stadium while people are getting the vaccine? Is that something in the works?
Well, I think that would be a question for Michael Bidwell. But boy, J.J. Watt, everywhere he goes, he's incredibly philanthropic and community-minded. And not only is he one of the fiercest players in the league, he also seems to be one of the kindest. And when Texas was going through so much of what it was going through with the flooding and other issues, he was a real leader. And it seems like he got off to a great start here by reaching out to the community first thing. So we're excited to have him here. We've got a great franchise that's only going to get better, and we're thrilled that JJ chose the state of Arizona and the Cardinals.